Hi y'all. So my part's gonna be over intracranial hemorrhage. Now this is the most common type of birth injury a baby can have. It occurs more often in preemies than it does in full-term babies because the blood vessels are too fragile. Now how does it happen? The blood vessels of the skull break and the bleeding goes into the brain. This can happen in the subdura, subarachnoid, and intraventricular. I'm sorry. And this can happen during delivery or prolonged labors. And that's when the newborn's head is larger and can happen when the newborn's head is larger in comparison to the mother's pelvis. Now, the manifestations of this can occur suddenly or can gradually appear. Signs such as poor muscle tone, lethargy, poor sucking reflex, respiratory distress, cyanosis, twitching, forceful vomiting, a high-pitched shrill cry, and convulsions all can occur when there's a intracranial hemorrhage. If the symptoms are mild, there's a good chance that the patient is going to completely recover and not have any leftover residual effects. That's the word I was looking for. But death can result if there is a massive hemorrhage. Infants who survive extensive hemorrhages may have residual effects such as intellectual impairments and cerebral palsy, and we see those commercials about if you think something happened while you were in labor that caused your child to have cerebral palsy, this would be something that could happen. Now, how is it diagnosed? There are a number of ways that you can diagnose an intracranial hemorrhage. It's the history to the delivery, just because it was so bad you can just tell that happened, a CT scan, an MRI, evidence of an increased ICP, because usually when babies have that, that's why this has happened. It's because they have an intracranial hemorrhage. And then the symptoms of the disease, that if you just see all of those, then your baby's probably got an intracranial hemorrhage. I keep wanting to say pressure, I'm sorry. Now the treatment is the baby is usually placed in an incubator, and this allows for proper temperature control and then ease in administering oxygen and continuous observation. It's handled very gently and as little as possible. This is one of those times we would want to do, I think they called it cluster treatments, where you can do as much as possible as you can at one time and then just leave the baby alone. The head is usually elevated, and then they're given vitamin K to control the bleeding and phenobarbital, if the twitching and the convulsion happens. They're fed very carefully because the sucking reflex could be impaired, and also the baby can vomit super easily. Now, the care of the nursing care for the baby is to observe for signs of increased intracranial pressure and convulsions, and then assist the physician with procedures like a lumbar puncture or an aspiration of the subdura hemorrhage. Performing neurochecks, monitoring vital signs and head circumference, and palpating the fontanelles are very essential in keeping the care of the child nice and healthy. Now, if a convulsion does occur, one of the things, knowing the characteristics of it is a big deal in diagnosing, for the physician to diagnose where the bleed is. So some questions you want to ask yourself when you see this, if you see this happen, is were the arms, legs, or face involved? Was it right side of the body or was the left side of the body involved? Was the convulsion mild or severe? How long did it last? Make sure you time them. And then what was the condition of the child before and after the seizure happened? And that's all I've got for you today. Hope y'all are staying safe. Thanks.